Hello students. Uh, I hope you all are doing well and inside your home contributing to fight against the present COVID-19 scenario. So as per your request, I have come up with another topic of the knee pain called Osgood Schlatter disease. So let us just understand few points about this disease. Basically, it is a disease when there is a knee pain, inflammation, swelling of the patellar ligament. So this is a rough diagram to make you people understand, and I hope you will adjust with my diagrams. This is not that much artistic, but we can understand. So as you can see, this is the quadriceps muscle, the anterior view of the knee, the quadriceps muscle, and this is the quadriceps tendon. It crosses the patella, which acts as a pulley in our body in exerting force, and then this tendon comes down continuing as the patellar tendon and gets inserted into a particular point which is known as the tibial tuberosity. This is the lateral view, the quadriceps tendon, the patella knee joint, and this is the patellar tendon coming and inserting into the tibial tuberosity. So basically this is the inflammation of the patellar ligament, and this condition was named after two orthopedic surgeons, that is Robert Osgood and Carl Schlatter. So the condition overall is known as Osgood-Schlatter syndrome, or the condition. So if you see the knee laterally, if you again basically try to understand, actually the proximal part of the tibia has the proximal epiphysis, and this proximal epiphysis has a particular point called the tibial tuberosity, which is considered as a apophysis, that is a bony prominence that serves as a site for tendon attachment. So the apophysis is a bony prominence that serves as a site for tendon attachment, and the patellar tendon comes and insert here. And the patellar ligament, mainly it works in extending the knee, that is the extension of the quadriceps muscle. So basically this is a condition or disease when there is too much activity on the patellar tendon, and the patellar tendon goes for strain and it gets irritated and inflamed. So let us understand how, because this is a condition seen in young adolescents when there is ossification going on. So at birth, when you see this bone, there is the cartilage and there is the ossification center. As the child grows by 9 years or between 15 years, this ossification center ossify and turn into bone. And by 17 or 18 years, it becomes the bony tuberosity. So it is seen mainly in young adolescents between the age 9 to 15 years when the tuberosity hasn't ossified. So basically you can say that at the young age, when especially the male, the boys, when they are very much active, they play around, they jump around, they hop around, they are very much active in sports. So at this growing stage, the bones grow fast, and sometimes what happens when the bones grow fast and the muscle cannot cope up with the bone growth, the muscle sometimes becomes slack, or there is pull or a tension on the muscle. So when there is a tension in the muscle, in order to cope up the situation, there is a strain in the tibial this patellar tendon, because it has the action of extending the knee. So what happens? That condition, when the muscles and the bone growth sometimes does not match, this is a theory actually. So that time the patellar tendon becomes too much stress and the muscle becomes too much of overloading, and at that time the patellar tendon becomes short, and there is a continuous pull from the point, and that pull makes the tendon irritated or inflamed. So it is common in young adolescents who play sports. The patellar ligament goes excessively for strains, and then there is the inflammation of the ligament, which is called as with the traction, the apophysitis. Sometimes during this period, the ossification center can crack into tiny bone fragments, resulting again in a callus during the healing process. It is actually a self-limiting condition, and it resolves itself as the ossification of the tuberosity continues or as the child grows. So the symptoms, basically we have palpable lump below the knee, that is painful with physical activities like jumping, running, squatting, mainly climbing up or down the stairs, or the knee getting hit by something. So there will be a pain in the at that particular point. And diagnosis, we come to diagnosis when there is the inflammation of the tibial tuberosity, which worsens with activity, and ultrasound investigations can show soft tissue swelling around the tuberosity, and X-ray can also show some fragmentation in severe cases. Coming to the treatment part, as I told you, this is a self-limiting condition by rest and it heals itself, but we have to focus on reducing the physical activity. If it is too much painful, you can apply the ice and the rest protocol to reduce swelling. We have to go for the pain medication as prescribed by the orthopedic surgeon or the doctor. Then sometimes in severe cases when it is not healed, people go for surgery, that is the ossical resection and tuberoplasty with suture anchor repair of patellar tendon. That is the ossicle, the tibial tuberosity which have the ossicles, that is resected, and tuberoplasty is done with suture anchoring in order to repair the patellar tendon. So this can be you can see this procedure in the mentioned YouTube link. Also I will send this link in your Google Classroom and WhatsApp group, so not to worry for that. And otherwise we have to wait it to heal as the child grows up, so nothing much of very kind of a serious situation. And then this is the briefly about the Osgood Schlatter disease. So let us recap. It is a inflammation of the patellar tendon at the tibial tuberosity, repeated traction of the patellar ligament on the tibial tuberosity, painful swelling under the knee. It affects young adolescents who are very active in sports. And there are a few basic physiotherapy exercises and stretching which we can prescribe or which we can advise, like the stretching of the quadriceps muscle passively, or stretching taught to the patient to do at home, self-stretching of the quadriceps muscle, stretching of the calf muscles, stretching of the hamstring muscles, and strengthening of these muscles, like straight leg raising, and then other quadriceps and calf muscle strengthening exercises. And these stretchings can be done 30-second hold with repetitions of 5 times and can be done at least twice a day. So I think this is about the Osgood Schlatter disease, and as I said, it is the inflammation of the patellar ligament that inserts on tibial tuberosity. This is the tibial tuberosity. This is a red circle here, this red part here. And it was named after 2 surgeons, orthopedic surgeons, Robert Osgood and Carl Schlatter. And the function of the patellar tendon is the extension of the quadriceps and extending the knee joint. Then the tibia has the proximal epiphysis. You have the tibial tuberosity, which acts as apophysis, that is the bony prominence that serve as a site for the tendon attachment. You have the cartilage and the ossification center at birth. This slowly ossifies into bone as the child grows, and by 18 years it turns into a bony tuberosity. It develops between 9 to 15 years. The tuberosity sometimes is not ossified, and then that part has become a little bit weak, and because of the activities and very active life cycle of the especially the male, the boys, they run and they are engaged in various activities. Because of that, their bones grow very fast at the growing stage, and then sometimes the muscle cannot cope up with the growing bones, and then indirectly there is a strain on the quadriceps muscle, the quadriceps ligament, and the patellar tendon, and patellar ligament, and then it goes for the strain. This is the patellar tendon, the quadriceps tendon. This is the patellar tendon, which excessively gets strained up, and there is sometimes inflammation of the tendon, and resulting in traction apophysitis. So the ossification center sometimes can crack into tiny bone fragments, resulting into a callus and a development of a lump, which you can feel, and it usually resolves as the ossification of the tuberosity continues or as the child grows. So as I said, palpable lump below the knee, painful with physical activities like jumping, running, squatting, climbing up or down stairs, or the knee when gets hit by something on that particular point. And the diagnosis we confirm by the inflammation of the tibial tuberosity. Ultrasound can show soft tissue swelling, and X-ray can show fragmentation in severe cases. Treatment is to basically reduce the physical activity, applying ice to reduce swelling, pain medication, and also in severe cases surgery. So this is about the condition called as Osgood-Schlatter disease, and please feel free to ask questions, give your comments, suggestions, feedback on the YouTube link, which I will share in the Google Classroom or in the WhatsApp group. Okay, that's all. Bye bye. Take care.